It's now time for On Point, where we speak to experts to delve deeper into the biggest news stories in the spotlight right now. With a decline in COVID-19 cases, not just here in South Korea, but throughout the world, hopes are high that we might be inching closer to finally overcoming the pandemic.
But with fears of new variants, concerns remain on how much more prolonged the pandemic could become. Now, to get a closer look at the global COVID-19 situation, we connect with Ben Cowling, Chair Professor of Epidemiology at the University of Hong Kong. Very good morning to you, Professor. It's lovely to see you again.
Good morning.
Right. Well, first off, Professor, are we seeing an overall downward trend in the number of global COVID-19 cases, or are there still parts of the world where it's pretty much a big concern?
Well, there are some parts of the world that are still dealing with COVID. Shanghai has been in the news, of course, but globally, the COVID deaths are actually the lowest they've been for the last 2 years, which is really good news. We know the case counts can go up and down for various reasons. Some countries are not counting as aggressively now as they have been in the past, but COVID deaths are still going to be fairly well documented. The fact those are really low right now is good news.
Now, I want to kind of go over to the African continent because Africa is actually seeing one of the longest running decline in COVID-19 numbers since the pandemic started. But we're looking at a place where they're reporting one of the lowest number of vaccination rates in the continent. How is that possible?
Well, we have to recognize that the immunity someone gets after an infection is quite comparable to the immunity they get after vaccination. The reason we prefer people to get vaccinated than infected is because infections can be dangerous, particularly in older people, people with underlying medical conditions. In Africa, COVID's had an enormous impact, but right now the levels of immunity are sky high because of the levels of infections that they've had particularly in the past year. So I'm not surprised that the levels of incidence are low at the moment. When there's a new variant, we'll see. Remember, Omicron was first detected in South Africa, but there's a high level of immunity right now, not only in Africa, but in many parts of the world because of infections.
And Professor, the Southern Hemisphere is going to welcome the winter season soon. And of course, normally we see a higher risk of another wave of infections during the colder months. And well, how concerned should we be this time around?
So I think Australia and New Zealand are still dealing with their exit waves. So they're going to be very cautious this winter in their Southern Hemisphere. In South America and in southern parts of Africa, I'm not sure if they'll be so concerned anymore because, as we mentioned, there's a high level of immunity there, somewhat from vaccinations, but also to a great degree from infections. So I think we will see COVID resurge in the winter in the Southern Hemisphere, but it won't be much of a concern particularly for South America and for Southern Africa.
You know, one terminology that we haven't really been using quite often is the term herd immunity. Now, so many people are catching Omicron that now they're saying, well, herd immunity could be potentially achieved. Is this possible right now globally?
Well, in Korea, you have herd immunity for Omicron BA2. The reason that your case counts are coming down, whereas they were going up just a few weeks ago, is because you've passed the herd immunity threshold. In other parts of the world, they've certainly passed the herd immunity threshold. But of course, it's not necessarily a permanent state. We know that immunity wanes over time. So somewhere that has herd immunity may not have it for a long time. And also when new variants emerge, as with Omicron, as with the next variant in the future, the immunity will be different. We have places like South Africa that had a very high level of immunity to Delta, but when Omicron came, it was able to get around that and the herd immunity is gone. So we have herd immunity now in many parts of the world, but it may not persist for a long time. We'll see what the virus does.
And well, Professor, that actually leads to our next question. So many are hoping that even if another variant emerges, that it will be weaker than the Omicron variant. Do you think that's a safe bet, or could it actually turn into a stronger variant like Delta?
I think it's a pretty safe bet that the next variants that emerge will not have as much impact as Delta did, as Omicron did. But that's not necessarily because the virus is weaker. If you look at Shanghai right now, Omicron can do a lot of damage. It can spread very, very quickly, and it can cause severe disease. In Hong Kong, we had more than 8,000 deaths in just 2 months with Omicron. So I think it's not necessarily the virus that changes, but the immunity that builds up in the population that means future variants will have less impact. That's good news, I think, in terms of the concern about pandemic, the concern about COVID. We don't need to be so worried looking to the future.
Certainly some pleasant news there, Professor Cowling. As always, thank you very much for your insight and looking forward to talking to you again.
Thank you.